tumor markers in the testicular germ cell tumors. So to begin with, this we look at the three categories. So before we start, some questions. Tell me the levels of the tumor markers in case of yolk sac tumor. And next question is, tell me the level of the tumor markers in case of the embryonal carcinoma. So we'll be answering these questions in this video and we'll learn more in detail. To begin with, we look at the seminoma. So the three categories we are going to look at. We are going to focus on the AFP, the beta HCG, as well as the LDH. So now we are focusing on the seminoma. So seminoma, there is no AFP, there is increase in the beta HCG as well as the LDH. Then we look at the yolk sac tumor. So what happens in the yolk sac tumor? There is a significant increase in the AFP. And in terms of the beta HCG and LDH, it is also present, but if you look at AFP, it is significantly high. Then we look at the choriocarcinoma. So what is the choriocarcinoma? So here the AFP is not there and it is negative. Beta HCG, if you see, it is significant. So in case of choriocarcinoma, the beta HCG is very significant. And looking at the LDH is also little present. Then we look at the embryonal carcinoma. So what is the embryonal carcinoma? So here we need to know that the LDH is slightly high, and whereas the AFP and beta HCG are positive. So next we move on to the teratoma. So what about teratoma? So in terms of the teratoma, so in case of teratoma, it is completely negative. AFP is not there, beta HCG is not there, and the LDH is absent. Now we'll be answering our questions. We asked 2 questions initially. So what are these 2 questions? So first question was, what is the yolk sac tumor? So in terms of yolk sac tumor, the AFP, so to write it down, AFP, then we look at the beta HCG and the LDH. So in terms of the yolk sac tumor, the AFP is significantly high. Then we have the beta HCG and the LDH. Then we look at the embryonal carcinoma. So here also everything is increased, whereas the amount of LDH is significantly higher. Whereas in case of yolk sac, the AFP is significantly higher. Now to check our level of understanding, we have some bonus questions. So bonus questions are based on the topic we have discussed now. So you can write this in the comments. First question being, what are the findings in case of seminoma, the tumor markers? The second question will be, what are the findings in case of the choriocarcinoma? So you can answer these questions in the comments.